والآن لدينا المحور الأول للمؤتمر التكنولوجيا الصحية والطب عن بعد برئاسة دكتور كاترينا هيدبيك. So, Dr. Katerina, you can have the mic right now.
Thank you so much. And thank you for inviting us. My name is Katarina Hedbeck. I'm a CEO and co-founder of CEO Interlinked. And today I'm happy to share that I'm here with two friends, Caroline Dahl and Niklas Lundqvist. And together we will guide you through an in-depth look at a journey from product development through starting a company and finding funding, and then finally some thoughts about exit opportunities. So it's really nice to be here again. Thank you so much, Dr. Hanadi and Amal Almola. So without further ado, I'll hand it over to Caroline, who will start.
Thank you very much. And I will share my screen. Can you let me know if you see my screen?
We do, Caroline.
Thank you very much. First, thank you all for having me today. I'm calling in from Stockholm, Sweden, and I will give you an overview of revolutionizing health tech today. And the reason I am here to speak to you is because I am lecturer and PI at Karolinska Institutet in Sweden, and I had two courses at Karolinska, one in product development and the other to do with industry. I want to spend these first 15 minutes with you talking about what makes for revolutionary health tech. And there are many ideas regarding principles and processes of how you arrive at something that's truly significant, truly new and novel. But I have focused on one process and two principles to share with you today. The first one is the process of biodesign or clinical innovation, which is led by the Stanford Biodesign Department in the US. Karolinska Institute practices this type of product development, and it's divided into three separate phases. The first one is to do with identifying a big need, a big enough need that you can actually launch and scale, a need that is a proper need, not just a local one for a particular hospital, but one that is reflected across the globe. The second phase, the invent phase, is about solving for that problem that you have identified. And the third phase, implement, is regarding strategy, regarding founding your business, planning, immaterial property, the works. So to start off with is the identify phase. And I wish to bring you straight into the clinic here, because there is no way for you to understand the problems of the people in the clinic and the patients in the clinic unless you are there to speak to them yourselves. So everybody during the program in Stanford and also the one that was hosted here in Sweden spends months alongside the patients and the clinicians on site in hospitals. You are teamed up with people who are not part of your own background. You have multidisciplinary teams, and you make these observations regarding what works and what does not work. And I believe thoroughly that you need these new eyes on an old setting in order to identify what can be changed for the better. Secondly, the invent phase can be broken down into smaller parts. The first big thing is concept generation. The second one is concept screening, and I will let you know what those are. And this is the phase that I personally teach at Karolinska Institute every spring to my master students. This image is from the Stanford Garage innovation process. And once you have landed a need that you believe is large and big enough that actually cuts the global score, then you thoroughly immerse yourselves in that need and explore it. You get to grips with all the parts of that need and the stakeholders of that need, both the patients that might be critically involved in it, but also the clinicians treating it. So you need to know all the stakeholders in order to go forward. Second, based on the opinions of stakeholders, you ideate and you try to come up with a brand new solution that fits the bill, that really not just solves the need, but solves the need in a way that stakeholders can actually make use of that solution. And you iterate a million times. Sometimes you have to pivot to a completely new type of prototype or a new type of solution, and you test it with those key stakeholders that you have identified and talk to so much during interviews in the first explore and immerse phase. I teach this module at Karolinska alongside real experts in this field, and I'm pleased to have Relink as one of the speakers at my course each year. Moving on from this process, I want to speak to you about two key principles when inventing something novel. The first principle is the one of abstraction. And I know that this was spoken about briefly on a couple of days ago during another panel. The idea is that you have to focus on the right target. So which target do you pick? Here's an example where you are trying to tackle a stroke. So you have somebody who is at risk as getting a clot in his or her brain. And you can choose to focus on that problem and say that you want to prevent a clot from leaving the heart and ever reaching the brain. That's one level of abstraction. But if you move up a level of abstraction, then you could even prevent the clot from forming in the first place. So depending on where you have your level of target, that depends critically on what types of solutions you come up with in the end. So as an example of this is still talking about strokes. The way that you try to treat a vessel that has a plaque in it is by introducing a small balloon made out of metal and then pushing the plaques to the wall to make space for blood to come through. But in the process of pushing this plaque to the wall, there is some debris from the plaque that can come loose and then go in the bloodstream and eventually, if you're very unlucky, end up as a clot in your brain or elsewhere in your body. So, how can we tackle this, and where do we put the level of our target? Well, we could put the target as a kind of a new type of stent that prevents the vessel wall material from embolizing in the first place. And if you do that, then you end up with different types of stents that all do the trick. They could have some kind of drug in it. They could be specially formulated using a particular materials, etc. So this is a stent-focused invention. If instead you create a need which is at a higher level, and the target is now a way to prevent the consequences of emboli due to a vessel procedure. Then you end up not only with the inventions from the stent-focused target, but also completely different types of solutions. For example, you could target a way of capturing all the debris upstream or downstream. You could try to get drugs to tackle the debris in the first place. You have nothing to do with the stent, as well as completely stent-focused solutions. So I hope this gives you an overview of how level of abstraction really plays a key role in an inventor's life. And this is an example of such a high abstraction solution in this type of net that you place downstream of the stent so that it captures debris that comes as the stent is inserted. I want to bring you principle number 2. And this is an example which is, I think, more closer to home. When you have a toddler and he or she wishes to learn how to bike, but biking on 2 wheels is very hard. And designers add a wheel, add 2 wheels, add a wheel at the front, at the back, maybe 2 wheels, and trying to balance the bike at the back in order for the kid to be able to bike along a pathway. Now, it turns out that the solution all along was to remove such wheels. And today we have balance bikes that just completely took over the entire market. Principle 2 is the principle of reduction. So this is where you start to remove things that have been put on, features that have been put on to inventions, and actually create something that is much more genius and that solves the problem and does so much more inexpensively. With that, I want to thank you for listening to me, and I want to hand over to Relink, who are practicing both the innovative process of clinical biodesign as well as both of these principles. Thank you.
Thank you. I will also thank you. It was amazing hearing you. I will share some slides as well. Perfect. So the company is interlinked and our product is Relink. And as Caroline said, we started off at the Clinical Innovation Fellowship where we identified unmet needs in healthcare. And I will hide. I will focus first on our origin and vision, and then go through where we have, after we started the company, a little bit of power of choice, and then a vision for an exit. We started with the observation of finding a real need. So we spent time at the hospital to identify unmet needs. And we looked at end users, workshops, and also the alignment and the market and the patients and all the groups around, because everybody are part of the community. And if there is not an alignment with the problem and who actually pays for the solution, it's going to be very difficult along the line to actually sell in your solution. But that is where we found the need for safer infusions. You're gonna come to that on the next slide. But I also want to highlight the entire collaboration part, because it's an ecosystem around the team from clinical innovation team initially, but also then around Stockholm and Europe, who help us and have it's a giving environment, coming up with new product development and ideas in healthcare. It's been pretty amazing, actually, the entire journey, finding the need. So we were at the Children Oncology Clinic to identify the needs, and we realized that IV therapy, the catheters get pulled out. And initially we thought it was only at this clinic. So we started Googling and searching for a solution that would solve the problem that they had at this ward, because part of the program is you shouldn't invent the wheel again. If something exists already, you should leave it. It's so many things that you can improve. So, one should pick something that is actually innovative. But when we were looking for safer ways to handle IV therapy, we realized that the problem when you have a catheter and an IV line, there are pulls on the line that causes the entire catheter to get ripped out during use. IV lines that you see here at the lower picture in the middle, 16 billion of these are used every year, and more than 1.5 billion catheters. 10% every year get ripped out during use. That is more than 150 million IV catheters a year that gets ripped out. If you have chemotherapy in the IV bag and it gets pulled out, you have a risk for healthcare personnel and everybody around to be exposed to hazardous drugs. And if it gets ripped out from the patient, they get hurt. So all of those, the consequences of those problems is that you have safety consequences, the patient get injured, they can even die, and then you can lose expensive medication, and there is a risk of toxic exposure to the healthcare personnel. From a financial point of view, it takes time to reinsert IV catheter. You have to throw away everything due to risk of contamination, and it adds up to 72 billion euros in unnecessary healthcare consumption. And when the problem is that something breaks, the standard solution is to make it stronger. We did the opposite. We made it weaker. So we added a smart breakaway connector. When there is a harmful pull on the IV line, our connector splits into two parts. Double valves keep blood and medicine from spilling, and you can use the protocols at the hospital to clean and reconnect the parts again to rapidly reinstate therapy. And the process so far is that the first patent is approved in 26 countries. Then we have 3 additional patents and 1 patent pending. We have regulatory approval that is really, really needed in healthcare, is that the CE and FDA registration for class 1 is clear. The CE mark MDR for class 2 will be, we expect it within around New Year. We have had all the audits for that part. We have clinical evidence, and that's really important in healthcare. Marketing is basically evidence-based in medtech marketing. We have a design freeze, and we have a small, stable production setup. And now, since last, we have committed order and a strong pipeline. So we have a sales contract signed. We know that the minimum order quantity that is already signed is for 3 million euros, but the sales pipeline is a lot longer. And as you can imagine, with 16 billion IV line used every year, there is a huge need. I come back to collaboration. This is a slide that we used a long time ago, actually, but it's still accurate. And it's people that we worked with along the line to make sure that, and I think it's part of making sure that the product that you actually get out is needed. And Sweden is a rather small country, so when we develop something, it sort of needs to be for a larger market. So we have developed Relink to fit a global problem for a global market. And when it comes to evidence, we have done 7 clinical evidence. Some of them are complete. Sometimes here it says in progress on the second one, that is in Spain and Portugal. We have enrolled the last patients, but we're submitting the data. And then when it comes here to Ireland and Galway, that is not for IV, it's for, there is like catheter that is linked into the kidney, so it's nephrostomy drain catheter. These also get pulled out. It's less frequent, but in 5.5% of the cases it does, and it costs up to 10,000 euros to replace them every time. And the doctor in Ireland that we're working with, he contacted us because he lost a patient when the catheter got ripped out from the kidney. The patient got a septic shock and died in the aftermath. So he thinks it's neglect not to use our product, but it's quite a long way, and I think it's somewhere here one can't do everything, whereas when we obviously do step by step and focus. I will come to a slide later on with all the possibilities that Relink would have. We have developed it as a platform technology. There is an impact though. So the first clinical study we did in Akademiska sjukhuset in Uppsala, we showed a 73% reduction in IV dislodgement, 90% less time to restart the IV line, and we cut the cost by 70%. So it keeps the patient safe, the nurses safe, it supports accurate drug delivery, and enhances nursing capacity. I will have a break here and stop sharing and hand over to Niklas, who will talk about funding all of those operations. Do you want me to share your slide as well, Niklas? Niklas, we don't hear you.
There is no voice, Niklas.
Is this better? Okay, good.
That works, yes.
Okay. Can you see the slides? Okay, thanks. My name is Niklas Lundqvist. I am the founding partner of Meander Capital. Meander Capital is a Nordic investment manager focused on investing in smaller companies and also raising money to innovative companies with a global reach like Interlink. Not that we work with Interlink, by the way. So thank you everyone for the opportunity to discuss a topic that is both dynamic and central to growth in innovation in the Nordic region, the fundraising environment. Over the past 5 years, we have seen significant shifts and adaptations influenced by economic conditions, regulatory changes, and global trends. Today, I cover how this landscape has evolved, where we stand now, and the opportunities that lie ahead. To understand the present, let's first take a look back. From 2018 to 2020, fundraising in the Nordic region saw robust growth, especially in venture capital and private equity. This growth was particularly driven by technology, medtech, clean energy, and life science, which levered the region's strengths in innovation and commitment to sustainability. With the arrival of COVID-19 in 2020, fundraising experienced a temporary pause, capital shifted toward crisis management and pandemic response. Early stage funding rounds and public investment faced challenges. But what was remarkable was the rapid recovery that followed. Thanks to a solid infrastructure, digital readiness, and supportive government policies, the Nordic recovered quickly. By the end of 2021, venture funding hit record levels, particularly in tech and sustainable ventures, reinforcing the region's position as a leader in sustainable innovation. Today, the landscape is quite different. 2023 and 24 have introduced new complexities. Inflation, of course, rising interest rate, global economic uncertainty have led to a more cautious investment environment, with a shift towards later stage companies that demonstrates performance and profitability. Despite these challenges, the Nordics continues to attract capital, particularly in sectors aligned with global priorities. Investors are increasingly seeking projects with both financial returns and measurable impact, especially in sectors such as renewable energy, green tech, and healthcare. The convergence of sustainability and innovation is driving strong support for ventures in climate technology, for instance. Regulation has also shaped the current environment. The Nordic have long been known for progressive policies, and recent regulatory frameworks like the EU's Sustainable Finance Disclosure Regulation, SFDR, and the Taxonomy Regulation have set standards that influence both investors and companies. The Nordic countries have embraced these measures, enhancing investor confidence and clarity by aligning capital flows with green and social responsible objectives, therefore reducing risk associated with so-called greenwashing. Looking ahead, the Nordic fundraising landscape will likely continue its focus on sustainability and tech innovation, with a more disciplined and selective approach, though. Key areas to watch include including integration of AI, of course, and machine learning, where the Nordics have clearly established as a strong presence, and cross-border investments. Public-private partnerships are also expected to play a larger role. These collaborations have been crucial for addressing large-scale challenges such as climate change, digital transformation, and healthcare. And in a time of economic uncertainty, offer a way to share risks and advance impactful projects. One exciting dimension of the Nordic fundraising landscape is the opportunity it presents for international investors, in my opinion. The Nordic consistently rank high in global indices for innovation, sustainability, ease of doing business, making them an attractive destination for international capital. Several factors make the Nordics particularly appealing. The region's commitment to sustainability aligns well with the global emphasis on sustainability goals and impact investment, particularly in renewable energy, health innovation. In medtech, for instance, the Nordics offer unique advantages with a robust public healthcare system and high digital adaptation, providing a conducive environment for scaling and recessing health technologies. For international investors, this translates into access to cutting-edge solutions with potential for global expansion. Additionally, an international partnership and capital can provide Nordic companies with the resources needed to expand beyond the region. while Nordic companies lead in innovation, breaking into larger markets in Europe, US, and Asia, for instance, often requires substantial capital and strategic alliances. In summary, the international investors seek stable, forward-thinking opportunities with a sustainable focus. The Nordic region provides a compelling case. From early-stage startups to growth-stage private equity and public investments, there are significant avenues for impactful long-term investments. International capital not only fuels Nordic innovation, but also supports the global spread of sustainable advanced solutions. To summarize, the Nordic fundraising landscape has seen rapid growth, pandemic-induced pause, a resilient recovery, and now faces economic pressures that have led to a selective investment environment. The Nordic remains a beacon of innovation and sustainability, in my opinion, and while caution may be prudent in the near term, the fundamental strengths of this region, its commitment to sustainability, skilled workforce, and forward-thinking policies, will likely continue to attract investors looking for both financial returns, of course, and meaningful impact. Today, there are many compelling investment opportunities in the Nordics, driven by attractive valuations and a historically weak Swedish and Norwegian krona. This currency environment enhances potential returns, particularly for international investors, making Nordic assets more affordable and increasing the incentives to explore these opportunities. Resilient sectors such as technology, renewable energy, medtech, and natural resources offer substantial potential upside, and future currency appreciation could very well amplify returns on investments made today at these exchange rates. I would encourage you to explore these opportunities and consider the benefits of investing in Nordic asset this opportunity. Of course, if you look for a partner, we are willing to help. And with that, I leave it to you, Katarina. Thank you.
Thank you. Yes, I think thank you so much, Niklas. And I think we all know that whatever we're doing, we need cash to move forward. We founded our company in 2016 after we spent the 1 year, the 8 months at the Clinical Innovation Fellowship. But up till date, we have invested 8 million euros into our company. A lot of this money comes from the European Innovation Council that has granted us 3 grants. And also, I mean, it's 7 clinical trials, a lot of things cost, what you need to do, a lot of testing, biocomp testing, different kind of testing, it costs a lot of money. Whereas now, I will come to where we are, but funding is always needed in all these journeys. And there is an upside, of course, because eventually there will be money coming back. Yes. I am talking about our sales pursuit process now. Before we continue, I just want to say that it is we have it on 2 legs. And I think it actually comes from our heritage from the clinic that we always want to have a little bit of, we want to stay a little bit in the clinics, basically, to get the end users' interest and their feedback. And it's not only to make sure that we are on the right way, it's also because we want to have scopes for new products, actually, and you always get feedback from nurses and doctors when you interact with them. But it also does help to get key opinion leaders their reference, and when we are at international conferences, we pinpoint these. So on the top here you see WCOVA, that would be World Congress of Vascular Access, and AVA is Association of Vascular Access. All of them are with IV therapy. We will add more when it comes for nephrostomy drainage and home care in these areas. Then we target through social media. We have targeted LinkedIn campaigns with the ones we actually want to work with when it comes to B2B partnership. Mainly because there are so many companies out selling products to hospital, but we need to have it pinpointed. We need to make sure that they also sell IV lines and nephrostomy drainage lines, and that they are used to market a new product to the market, because it takes time and it is a lot of hard work. So we have done in-depth, we looked at more than 300 sales partners and got that list down to below 100. And then we connect and try to engage with them and move forward with NDAs and letter of intent, negotiation, and then sign off. That is a little bit of our pursuit process moving. When it comes to moving forward, these top 11 countries or regions are the ones that we've come the further most with. But we are looking into, we also have some leads from Kuwait actually, and from Qatar, Oman, and Saudi. But we do want to, very often the regulatory pathways in Middle East it's quite easy if you have the CE MDR mark, whereas you still, of course, need to do the proper work per country. However, I just wanted to show a little bit of numbers, because when it says opportunity size, that would be annual tubes consumption in million units per these countries. So in Sweden, we use 27 million, but if it comes to Italy, for instance, it's almost 150. And what we have done, we've done a lot of model work to look on what's the adverse event, how much does it actually cost at the hospital, what would it cost to, all the cost for catheter dislodgement when it comes to nephrostomy drainage, and how much can we then spend on each relink if we want to secure everyone? And that calculation is quite sweet, since it's such a disaster to have them pulled out. But it's also a very good starting point for us selling in, since initially it costs a lot before you scale production. Every unit costs a lot of money, so it's very good to start in that end. Whereas we have then targeted countries that and sales distributors who work with IV as well as nephrostomy, and then we've targeted 2% of these countries and a cost of 4 euros. That would then, and 2% is not very much, but these countries alone with 2% would, when they've scaled up over 4 years, be almost 80 million units, and then times the 4 euros, that's almost 240 million euros in revenue. One could, of course, argue that isn't 4 euros, is it too high, etc. Whereas we have checked with a lot of different countries, and for nephrostomy that would work in quite a few countries in Africa as well, where the cost ratio is different. And one could then say if one should lower the 4 euros, then the 2% needs to go up, because then you can untap new market opportunities. So it's a very nice, I like that work actually, because it made a lot of sense. But then this would basically, we just, it's a conservative projection on the volumes and the revenue. And moving forward from those things, we look at investments into phases, and the phases have to do with scaling production to be able to then meet these demands. And the first phase would be to produce a few million, and then second phase would be to get the COGS down really, really low, basically, so you could serve a global market. That would be the scaling. I'm jumping totally actually to where we started. I think this is one of the, I actually took it from the first presentation I had 2 years ago with you. At that point, we had not done so much work when it comes to manufacturing or regulatory or the sales bits and pieces. We were very much still in how can we broaden our product, where can it fit in different areas. We brainstormed a lot about how can we use Relink on loads of different applications. And I think it's also because a lot of our heart goes in here. And that's like identifying new ideas and unmet needs, and how can we use the platform, a breakaway connector with a membrane design and the sealing, material science, and then have a paradigm of safety connect with coating that fits in a lot of different settings. And somewhere when I see this one, it always makes me happy, because I think the heart is in product development. Having said that, moving forward, we have the ones that we realized, that we can actually sell would be now for the IV infusion in hospitals and the nephrostomy drainage in hospitals. We are looking into having it outside the hospital. We are looking into having actually a telemedicine scope and study in March, but it hasn't been signed off yet. But there are a lot of more opportunities. But I think it's also sometimes you need to focus and make sure that you get all the pieces done, from regulatory to manufacturing to sales. This is also from the very first, when we were 2 years ago, when we spoke here, there was a value gap. And I showed this slide at that point. I just added a new heading, because there was there was a value gap. Basically, we had a brilliant idea, but we didn't have the regulatory approval. We hadn't set up the manufacturing, and we weren't where we were today with a sales distributor partner. So at that point, we were looking for a partner that could speed that up, where we then would do basically only half and then do more R&D work. And you might wonder, why didn't we go for that then? And that was because the licensing and royalty, when we looked at the calculation on how much do we get, and the risk for the people who didn't then want to commit to volumes, it didn't really add up for our investors. So we continue to fill up the value gap in between. So now here, yes, licensing models, it would give us roughly 7% from sales bits and pieces, whereas if we do the manufacturing and the regulatory work, we get up to, more 60%, something like that. And it's also keeping the control and owning up to knowing that sales distributor can do a lot of cross-selling and adding a lot of value there. So it was an in-depth work with looking into the value-adding enhancement. But it's still interesting to look back, I think, and look on lessons learned. And you plan, and sometimes you shift, but you still move on forward. What we also did after those 2 years ago, there is a Swedish company called Apolonian. They helped us with the due diligence, but then we also did scenario planning. So we did 4 scenarios, one where we kept on with the R&D bits and sold for the 7%, or we, had our scenario that we're working with now, that was actually scenario 4, whereas then it's to partner up with sales distributors, but have a contract manufacturing who actually helps us with the production. And that outshined all the other scenarios. It was more value for the business. But I'm here on point 3 now, shooting on a moving target, because sometimes when you do DDs, it is a little bit like you don't really know what happens in the future. Whereas if you do the hard work, you get the more qualifying guess. And we do believe that we are, really on the right, that we picked the right bits and pieces. And we have done loads of work when it comes to the manufacturing, the sales channels, and regulatory work. And we are, as we speak, scaling production to push down the COGS, but that's going to be in the 2 phases. And there is still work ahead, whereas we do know that our product is scalable at low cost, so that is good. And then we want to keep on collaborating for more market reach. So the impact of what we're doing, that's the sales channels. So we get the sales distributor that we want to work with, we want to give them exclusivity per each country, so they can do cross-selling and sell more of what they are already selling. For that, one can look into the PONT model, where you increase the price and increase the market share a little bit, or you can add into a new business area. The impact is also manufacturing, that we increase our knowledge there and own it, basically. And regulatory-wise, it's step by step for each country, of course. So coming where we are, we're sending out samples to select the sales distributors and key opinion leaders for clinical evaluation. We are up to signing more distributor agreements and signing off trade financing agreements, also to fund further commercialization and scaling. We will submit FDA class 2 clearance, and we want the Saudi FDA and more on the regulatory side. Continue to scale production and expand market reach. Lessons learned. It's a journey of a lifetime. I also learned that it's harder than I imagined. It's more rewarding. It has actually changed me to the core. And the path we first sought, it wasn't the best. We got help from the people we were working around and changed it slightly. And this job and this journey that we are on, you learn every day. And I think when I say harder than I imagine, I think it's you're on a roller coaster. And I like roller coasters. It's just that this roller coaster, it never stops. And I think that is sort of the thing that I thought was harder, actually, because you never get a break. You just continue and you go and you go. But I wouldn't want to live without it. Of course, it's amazing. And collaboration. This would not be. I would never manage on my own. It's a collaboration things, and we also want to keep on doing that. So if anybody has openings for clinical trials or studies or new R&D ideas with our breakaway connector, that would be amazing to have further collaborations in hospital settings or off-site. And there's always space for new investors. That's on every slide and every pitch deck I ever send out. There's also a lot of opportunities for sales and contracts in the Middle East and beyond. But that would be amazing to get collaboration. I also would like to say a huge thank you to Dr. Hanadi and everybody for inviting me once again.